You have a coaching session available. Tap OK to begin. Hello, Matt. I'm glad you decided to join me again. In the last 2 sessions, I found out about you and how you feel about living with heart failure. You mentioned that you have been suffering from heart failure from between 5 to 10 years. That's a reasonable amount of time. Hopefully I can help you to better manage it. Today, I'm going to tell you a bit about what I've learned about heart failure from the health professionals who I work with. Before I start, I just wanted to ask, how are you feeling about doing this heart failure program? That's understandable when undertaking any new program. I'm looking forward to taking you through the program, and I hope that you learn something about heart failure that you didn't know before, even if it's only something small. Did you know that your heart is a muscle? It's true, it's a muscle that pumps blood to every part of your body. Check out the video below to see how the heart works and where it is in the body. Once you have finished, press continue. Even though it sounds like it, having heart failure doesn't mean that your heart has stopped beating. Heart failure is when your heart gets damaged, becomes bigger and weaker, and doesn't pump as well as it should. The body's need for blood and oxygen isn't being met, and it can make you feel quite unwell. Just at a guess, do you know how many types of heart failure there are? Spot on. There are 2 types of heart failure. The first is when the heart becomes weak and can't squeeze hard enough, and the second is when the heart becomes stiff and can't draw in enough blood after each time it squeezes. Both types of heart failure cause the same symptoms and are treated in a similar way. You may have wondered why you have developed heart failure. Well, damage to your heart resulting in heart failure can come from lots of things, including other heart conditions such as a heart attack, high blood pressure, an abnormal heart rhythm, arrhythmias, or heart valve disease. Factors related to poor lifestyle such as too much fat in your blood, high cholesterol, too much alcohol or drug abuse, too much sugar in your blood, diabetes, or being overweight. Then there are additional factors such as certain types of chemotherapy, infections, or it could be something you are born with. Are you aware of fluid buildup and its effect on heart failure? When your heart doesn't work properly, extra fluid can build up in your body and sometimes in your lungs. That's why it's important to look after yourself and follow the advice of your nurses and doctors. You will probably find that your symptoms tend to flare up every now and then, and the condition of your heart may continue to change over time. As your heart failure changes, so will your treatment. Living well with heart failure involves taking medicines, monitoring your symptoms daily, and making some long-term lifestyle changes, as well as having regular medical checkups. Who is the main healthcare provider that you see as part of your heart failure-related care? Great. Heart failure is a serious condition, and you will need ongoing help from your nurse or doctor to improve your heart and your health. You can't always make the heart stronger, but you can help to make it work better. Often you will have a team around you who will all work together to help manage your heart failure. This can include many health professionals and your family or carers who are also vital team members. Tell me, do you feel that having to manage heart failure limits you in your life? Thanks for sharing that with me. I'd like to check in with you later in the program to see how you are going with this. As we go through the program, I will give you some important information about heart failure as well as tips to make managing heart failure easier. Hopefully, what you learn along the way will mean that managing heart failure doesn't have to limit you in your life.